Hi, my name is Elisa Jones. I'm an associate professor in the Department of Family and Community Medicine at the University of Illinois College of Medicine, Rockford. I'm excited today to share with you our program called Compassionate Appreciation for Recovery in Everyone, the CARE program. We want to extend our sincere gratitude to the Winnebago County Community Mental Health Board for supporting this important program. This is our CARE program staff. Dr. Danielle Rodriguez, who's our substance use disorder specialist, Jordan Voigt, who's the physician assistant, substance use disorder specialist, Cindy Brush, our mental health specialist, Liz Sanders, our social worker aide, myself, Anita Bramble, peer recovery specialist, and Tricia Corrigan, who is a family nurse practitioner and director of clinical activities at Winnebago County Justice Center. The opioid crisis is a significant public health concern. Opioid overdoses in Illinois increased 8.2% just in 1 year, from 2021 to 2022. The number of opioid overdose fatalities is more than twice the number of fatal motor vehicle accidents and even homicides. According to the National Institute on Drug Abuse, nearly 85% of the prison population has an active substance use disorder or incarcerated for a crime involving drugs or drug use. Inmates with opioid use disorder are at a higher risk for overdose following release from incarceration. So it's so important to make sure that we are supporting their recovery, not just while they're incarcerated, but after they're released as well. And as you can see, this is also happening in our own backyard. Winnebago County has the highest overdose rate in the state. So the purpose of our CARE program is our focus is on developing and implementing comprehensive transition to care plans for individuals who are released from the Winnebago County Justice Center. We hope to reduce recidivism and associated deaths due to overdose. Our CARE program started in June 21. The population of focus then are formerly incarcerated individuals, and making sure that we provide them wraparound continuity of care services upon their release. They have to be 18 years or older and a resident of Winnebago County. The collaborators on this program is the University of Illinois College of Medicine, Rockford, Department of Family and Community Medicine, University of Illinois Health Miles Square Health Center, LP Johnson, Rockford, and Winnebago County Justice Center. The Department of Family and Community Medicine has maintained a strong partnership with Winnebago County Justice Center. For nearly 20 years, we have been coordinating and providing healthcare to inmates there, including medical and pharmaceutical services. Our CARE program components consist of providing individuals in our program a medical home. So many of them do not have a primary care provider, and it can be so overwhelming to try to identify one. And so we provide that for them. We also provide substance use disorder treatment, mental health services, and then community services linkage and case management. Miles Square Health Center, LP Johnson, is a federally qualified health center, which means that we provide services to the community who are uninsured or underinsured. Our primary care services are provided by family physicians and family medicine resident physicians. We also provide additional services, pharmacy-related, dentistry, and then our behavioral health services. In regards to our substance use disorder services, we provide medication-assisted treatments for opioid use disorder, alcohol use disorder, and stimulant use disorder. We provide an array of mental health services, including short and long-term therapy, cognitive behavioral therapy, and also trauma-focused cognitive behavioral therapy for individuals with a history of trauma. And as part of our CARE program, We also provide community resource linkage as well as ongoing case management throughout the program. So that consists of assistance with housing, getting connected to Rockford Housing Authority or Winnebago County Housing Authority, governmental assistance, even state ID, help, and food pantries, employment, and transportation, clothing. We also started a new program called the Care Phone Program, recognizing that many of the individuals released don't have a phone. And so we want them to participate in these health services. How can we get a hold of them? How can they reach us? And so it takes quite a while to get connected to get access to phone. So we make sure that for those individuals that need a phone, that they get a phone. And then we help them through the process so that they can transfer into their own services for later use. And this is just a quick little snapshot of the care program process. So right prior to the release of the individual, they'll meet with our peer recovery specialist, Anita, as well as meet with Liz to orient them to our program, to assess their needs and help schedule their appointments with us at the Mouse Square Health Center, LP Johnson. At their initial visit, they'll meet with Liz again just to check and see if the initial services worked out and if they need further assistance. And really, our process is always going to be ongoing assessment of needs because we know that things change and things can change really quickly. And so we want to make sure that we're responding as quickly and as effectively as possible. So Liz really is, making sure throughout the program that she's checking in on our participants and making sure that they are able to get to their appointments. If there's any challenges or barriers, she's working with them to address those. And so just want to share really quickly some data, some meats and potatoes, just to let you know, we have been able to serve over 400 justice involved individuals, a little bit over 200 just this past year. Most of our participants are between the ages of 18 and 59, are male, African American, Black, or Caucasian white, non-Hispanic. And we have, a significant number of participants who have both co-occurring substance use disorder as well as mental illness. And oftentimes when we think about individuals incarcerated, we tend to stereotypically think men, but we have a significant number of women who are also faced with incarceration, and we want to be able to provide needed services upon their release as well. And we do have a significant number of women with co-occurring substance use and mental illness. In terms of some of the community resources, needs of our participants, it tends to be housing and food tend to be the top two, but there are various needs and it's very individualized as we work with each of our care participants and make sure that they have access that they need. And I didn't want to end this presentation without providing just a little bit of feedback from our participants. And I wish I had that word cloud to kind of point out some keywords, but I'll just share with you, many of our participants talk about how they don't feel alone, and that, it can be really overwhelming and they're not just thrown out into the street, with no resources. We're there to provide that support for them. And individuals who are, in their recovery and their sobriety, commenting on how they feel like a totally different person, right? In a different space. And that's what we want, And so it just always provides us, with so much hope and inspiration. So in summary, providing behavioral health services and a medical home to justice-involved individuals as they transition back into the community, we really hope to reduce overdose and associated deaths, decrease recidivism, and as you can tell from the participant feedback, we support recovery and healing, growth, and we want to give them hope that they can be the best that they can be. And we are helping them with facing these challenges and barriers that exist. Just want to quickly acknowledge our other team members because even though they may not be providing direct services to our care participants, they are really a part of our village, helping us in developing the programming and problem solving, addressing these challenges that come our way as we work to support these justice-involved individuals. Our fierce leader, Dr. Joseph Gary, who's the head of our Department of Family and Community Medicine, as well as our other faculty and staff. And of course, thank you to Winnebago County Justice Center and Mouse Square Health Center. For more information, you can check out these links or contact me directly. Thank you so much.